Welcome back. Healing Steps to Wellness. I'm Dr. J.
And I am May, your trusted guide to whole person health,
One step
and one bite
at a
at a
time.
time.
Well, today is our honor to have a good friend, Dr. Melin from Mayo Clinic. Um, Dr. Melin had a presentation at our annual symposium in April, talking about lymphatic system. And before we get into the topic, Dr. Melin, please give us an introduction of yourself.
Well, first of all, it's a privilege to be with you both. When I look at community leaders, you both fulfill that role. I see you out working the gardens. I was walking back to uh, the hospital. What was that? A couple weeks ago, and you guys were
Yeah.
outside of the McDonald's house. You had just gotten done serving meals. The food, you gave me a meal. The food was phenomenal. So what you're accomplishing in this community is exemplary, and we really applaud both of what you are pouring into helping people understand eating is important, walking is important, exercise is important. And I think it's more of a privilege for me to be here than anything else. So thank you both. I appreciate the opportunity.
Thank you. You're very humble.
So I'm kind of a simple wound care guy at the institution. I am the medical director. I've been involved in wound care for 25 plus years. It really stemmed out of an accident that I was involved in where my right leg was injured. I ended up with a skin graft, ended up with a little bit of lymphedema, and that journey has just matured now into being a 60-year-old guy that has gotten deep into the weeds on lymphatics, making lymphatics function better, both from a local regional standpoint. So how do you make legs, arms, etc., but also systemically. So what are the things that we can do that systemically help lymphatics improve? And that can be done through eating, exercise, and a bunch of really good things, including, like we were just talking before coming on air, sleep. Sleep is incredibly
Mm.
important to holistic health. And I think we'll probably get into talking a little bit about supplements and where the science is on that, only because I think a lot of people look at supplements as, well, it's just a vitamin. It's actually, I would say vitamins are vital in the
Mm.
appropriate amounts, depending on the disease state, to help in terms of restoration of a well-balanced lifestyle again.
Yeah, absolutely. I usually tell my patient and when I do the education is we want to treat the vitamin supplements as the same as medication. The reason they work because it's just like medication. That's how they work. And so before we start, I would think let's explain what a lymphatic system is.
Mm.
So when I'm here in the office talking to our patients, and I just like, some of my favorite people to be with are our farmers, because our farmers understand water drainage and tillage and soil preparation and planting. That whole cycle is incredibly important. The lymphatics are throughout your entire skin. They're as dense as green shag carpet. Anything that's that dense in your skin must have an important role in maintaining the health of your skin. So you have this really dense component in the skin, and it acts almost like drain tile. So if you don't know what drain tile is, if you go out to a farm field, there are tubes that run underneath the soil, and the water will come down through the soil and it'll drip into this drain tile, and those are tubes that carry the water away so that you can keep from having flooded fields. Because if you have a flooded farm field, you can't grow anything, and that has a significant impact on farmers' functionality. So the drain tile underneath your skin would be called lymphangion. So the lymphangion is defined as a almost like a beating heart underneath the skin. There's valves in there, and there's part of the wall of the lymphatics is actually almost like heart-like muscle and also smooth muscle, which can function kind of in the same way your heart beats. We don't have to tell the heart to beat, it just does it. So that's called autonomic system. Your lymphangions are the same way. They'll squeeze and they'll push fluid up against gravity. So your whole system is trying to push fluid upstream from the foot to the ankle to the leg, all the way up to the level of the collarbones, because that's where your lymphatics empty into these big veins underneath your collarbone called the subclavian veins. So it's like an escalator. It'll move up a little bit. It might fall backwards with gravity to a valve, and the valves have to function like parachutes. Next squeeze, it pushes it up higher, and it just keeps doing that. The other interesting thing is the lymphatic system is it's considered to be subatmospheric in pressure, meaning that it's like a long straw. So imagine putting your mouth up at your collarbone and you have to suck on a straw that goes all the way down to your toe. You're trying to draw that fluid up. It's easier to draw up if it's negatively pressured. If it's positive pressure, it's much, much harder to suck up. So the system is really geared for success. And when we see patients in here in the wound clinic with venous ulcerations, diabetic foot ulcerations, other trauma, almost always their lymphatic systems are not functioning. And that's part of the reason they're not healing, because your lymphatic system, besides taking care of the fluid, is also incredibly important in the immune system. The immune system is what helps you to heal. So it all goes together very, very closely. So one of our prime focuses when we see wounds is how do we get the lymphatics working again to help reset the tissues, to drain the tissues, get them appropriately functioning, and then manage the underlying problem. If it's high blood pressure in the veins, so-called varicose veins, you got to treat those, get the diabetes under control, eat a good diet, get your steps in, sleep correctly, etc. So that's kind of a primer on the lymphatic system, but it's in every organ in the body: brain, heart, lungs, liver, kidneys, legs, and it is incredibly important. And I think we're really at kind of a paradigm shift in understanding how to incorporate it into daily medicine.
Well, when you talk about the pumping the fluid back to your heart, is it reason why sometimes people say the soleus muscle, the calf muscle, is considered a second heart? Because the big piece of muscle, when it contracts, you push the fluid back. Is something like that that's important for us to exercise or walk like that?
I think it's one of the important muscles. Again, if you look right underneath the skin where these little muscles are that are squeezing called the lymphangions, those are like the first layer muscles to draw down the fluid. The calf muscles will push it up. The diaphragm is your diaphragm below your lungs. As it goes up and down as you breathe out, that actually is drawing fluid up as well. Your torso, as you change muscles and twist, your torso helps with all that. That's why people that are very heavy, where they have a lot of excess weight around their middle, that deconditioning can make it more prone to having lower extremity lymphedema. So one of the things we talk about is how do we help our patients in terms of that middle weight reduction, which also helps them decrease risk of heart attack and stroke, because that's a different type of fat tissue than elsewhere. So all of it again fits together in terms of these layers of different places where muscles can be impactful in drawing that fluid up.
I remember your discussion on surgeries or injuries. Now, even for a finger and anything after injuries, sometimes the area is still swollen, and sometimes the tissue doesn't regain all the full function, and a lot of times it's because from the lymphatic system.
It's oftentimes because if you cut through the skin, you're by definition cutting through the what we call the dermal lymphatic system. And if you cut through that, you've just cut through your collecting system that helps move it. And like when we deal with patients that have really big venous ulcers on their legs, where some of these sores are so big. In fact, I had 2 patients in here today like this. The sore goes all the way around the leg. So there's literally no skin on the leg for that portion. So that's total disruption of your skin lymphatic system. So as you're trying to carry fluid up the leg, now you've lost there's a big gap, and that causes all sorts of things. So as you get that skin to regrow, over the course of months, you can get new lymphatics to grow so that you can help manage that fluid again farther downstream from where the sore is. So skin acute trauma, say, as you mentioned, a significant cut to a finger or etc., it really does have a huge impact. In fact, it brings up an interesting case about hyperbaric oxygen. Raymond Shields, Dr. Raymond Shields, who's in vascular medicine here and works over in hyperbaric, he and I reviewed a few cases of where they say retransplanted a finger, retransplanted part of a nose, retransplanted part of an ear, really, really significant edema after the transplantation. That's because it takes a while for the lymphatics to reconnect. And it seems like, and this needs more study, it seems like hyperbaric oxygen in some of those cases can help reduce the swelling quicker than some other types of technologies. Negative pressure wound therapy, which some of your listeners may have heard of, it's a sponge that you put on wounds. That's also been found to improve lymphatic function. John Rasmussen down at University of Texas, Houston, just published a paper on that earlier this spring, showing that negative pressure wound therapy actually stimulates those little hearts, those lymphangions around the wound to help suck fluid out. Kind of like what a manual lymphatic drainage does when a certified lymphedema therapist does gentle, purposeful massage on the skin to help drain areas of swelling.
I want to pause for a minute to ask a question.
I'm still processing. Very
Okay.
interesting. You know, the way that how Dr. Melin used that example for to explain how the lymphatic system work, and so I'm kind of processing. It's very interesting. I'm trying to picture that. So I've been thinking about we saw some people they have a very severe edema issue when they are where they have a hypertension or the type 2 diabetes. So in order for them to heal their venous issue, so then to help them better control their diabetes and their hypertension is kind of is critical, right? So Dr. Malin, you also mentioned about exercise, nutrition, sleep. So what comes to like a most important step that you normally advise your patient?
Well, I think let's just start local first, and then we can talk regional and holistic or whole body. If we're talking about patients with the most common type of ulcer in the lower
Mm-hmm.
extremities in the United States, it's called a venous leg ulcer,
Mm-hmm.
typically associated with varicose veins. But what's the other um, name for it is phlebolymphedema, because we know that anybody with a sore caused by varicose veins, by definition, has lymphatics that are not working. So it's two system failure. So compression would be standard of care, wearing good compression stockings or wearing some type of compression. There's many different types of compressions that we use when we're talking about wounds, including, they kind of look like ace bandages. They're not ace bandages. They're called short stretch wraps. Same thing that a
Mm-hmm.
certified lymphedema therapist will use with their lymphedema patients. And so treating that local area and getting all the extra swelling and edema out is very critical to maximizing arterial blood flow, because like roots of a tree or roots of a plant, the finest little root part of the root system is the most critical. That's where water absorption occurs. That's where nutrient absorption occurs. And so you've got to get that. But if the field is flooded, then you can't transfer nutrients and oxygen, and that's why you get
Mm.
the sores. So as you
Mhm.
naturally decrease the size of the leg by the compression, you'll maximize the arterial flow.
Mm.
And that's even in patients that have a palpable pulse. Just because you can feel a pulse in their foot doesn't mean they're going to heal if you don't take care of the swelling,
Mm.
because you're not maximizing the blood flow at the blood vessels the size of your hair.
Mhm.
Really, really important. And then the other standard of care besides compression would be see a physician that treats veins. You get an ultrasound to look at what veins are not functioning. And those can be treated with very non-invasive ways now, with uh, different types of heat. There's laser, there's a radio frequency ablation, which is kind of like a microwave. And then you can even inject foam into veins called foam sclerotherapy to get veins to shut down. But preventing that reverse venous blood flow into the sore, compression,
Mm.
that's what helps to get patients healed that have venous leg ulcers.
Mhm.
It's similar in diabetics. The interesting thing about diabetics is high blood sugars and a high what's called a hemoglobin A1C. So brief
Mhm.
explanation on that. There's your red blood cells typically last in your body 120 days, and then they're recycled by your body system. So that red blood cell, if it's sitting in blood that's really got a lot of sugar in it, that
Mhm.
sugar attaches to the red blood cell, and so your what's called your A1C will go up over the
Mhm.
course of that 120 days. So if your hemoglobin A1C is greater than 7,
Mhm.
that usually means your diabetes control could improve. And diabetes is a hard disease. I mean, it's kind of like a cancer. It's not a cancer, but kind of like a cancer, and you got to deal with it every day. You got to take treatments for it, and it's something you have for life. It's a very hard disease to have. But the diabetes makes your blood vessels very leaky. So think of a road that's got pavers on it, bricks. If those bricks are separated too much and it rains, all that rain pours below the bricks and damages the soil under the bricks, and then the bricks all fall apart. That's what's happening in all your blood vessels in diabetes. It
Mm.
slowly destroys all the blood vessels over the course of time. And this is why people get changes in their retinal function. This is why people get changes in their kidney function, in their nerve function, in the arteries in their legs. This is why the heart attack rate is higher, why stroke rate is higher, and why having a toe amputated or a leg amputated is higher, because it's contributing to development of peripheral arterial disease. So blood
Mm.
sugar control every day is critical. And there are these foods called high glycemic index foods and low glycemic index foods. And then there's foods that have fiber. So let's just pretend I'm going to show you something. Don't tell anybody this is in my drawer, okay? Snicker bar. I know you guys are going, he's got Snicker bar in his drawer. That's like insane. But like if you ate this, this is a high glycemic index food. My blood sugar is going to go straight up and straight down. And when it comes straight down, my body hasn't had time to catch up with the insulin. So now an hour later, I'm really hungry again because I have too much insulin. Now I got to take care of the shake. So what do I reach for? Then I would reach for my bag of M&Ms to take care of this. So it's kind of a vicious cycle. So you're doing damage with all these high glycemic index. Now, if you eat a apple, lots of fiber. So fiber will slow down how much that sugar is released, and it matches more, so the insulin release matches the sugar, and you're not having these wild spikes. So it's the same with fruits, vegetables, eating the whole vegetable, the whole fruit. And you both have taught me so much in nutrition. In the way that you eat and how healthy you both are, I think that says a lot about the importance of what we put in our mouth does really, really matter to not only arteries and veins, but now we're learning how important it is to lymphatic health. And again, lymphatic health is immune health. Immune health is so important for so many diseases in our body. I hope I wasn't too shocking with that Snicker bar and M&M thing.
Yeah. But just like you say, the lymphatic system, that the problem is over the body. However, not everyone, including the physicians, are able to recognize it. I believe I have a few patients I have to consult with you, that even the patient's primary care doctor or surgeons said there was no issue, there's no need to see you. But then the patient understand what I was saying and say they want to see you. So that is another example on it's a big issue, but sometimes it's ignored. So let's talk about the lymphatic system, and we all talk about when we sleep at night, the brain will have a flush into our brain and wash out the waste at night when we're sleeping. And are you able to talk about this system?
Yes, and I'm gonna put a caveat on this. I am not a brain expert. I'm a wound care. I really enjoy wound care and lymphatics. I gave this talk. I've given it a couple times actually, both for our Space Surgery Association because I'm also doing some stuff in aerospace medicine, and then I gave it at your community health and
Well,
wellness meeting that was in April of this year.
mm,
And so again, the caveat is I can talk about what's called the glial lymphatics or the G lymphatic system that flushes the brain. I am not a brain expert. So, if you're concerned about brain health, you want to see a neurologist, you want to see your family practice. That's where to start with. But it's the brain health is so fascinating because it's really what defines us as humans. I mean, if your brain doesn't function and you can't socialize, it's really what makes us human is our brain health. So as I've read about G lymphatic functioning, just thinking about how do I maximize my brain health over time, sleeping is critical. And one of the interesting things is if you're connected to what's called a circadian rhythm, so when the sun goes up and the sun goes down, thereabouts, your body is going to typically tend to function the best. So staying up till 2 a.m. and getting up at 11 o'clock, you may get the same amount of sleep, but you're not connected to kind of the bigger picture of the world. And then the other big thing is sleeping position. And Dr. Nidegard and Dr. Jeff Illig showed us this with a mouse model that was published in 2012 when they and their teams discovered the G lymphatic system. So when you look at a mouse sleeping, mice they sleep flat, they're not sleeping upright. And it was interesting to find out they usually slept on their right side because most of us, our venous system is right side dominant, about 65% of us. So when you go to sleep flat, you get a little bit, your jugular vein gets just a little bit bigger, and that little bit bigger has just a little increased pressure going backwards into the brain. And that's what kicks off this flushing system. So think of the G lymphatic. It's not defined vessels like the rest of the lymphatics in the body. Think of it as a sponge. And so if you were going to take a syringe and push fluid through a sponge, it's going to go through all these kind of natural holes. And let's just pretend the sponge is dirty. It's got some dirt in it. So as you flush the sponge, dirty water's coming out, but the more you flush it, it turns clear. So as our cerebral spinal fluid and our venous is helping to power and flush through this system, it's cleaning out the proteins that can accumulate during the day because our brains are working really, really hard during the day. There's lots of cellular turnover, lots of oxygen use. And so there's all kind of this dirty water that builds up in your brain over the course of the day. It's got to go someplace. So if it doesn't come out of the skull and recirculate to be repurposed, it's going to stay up here. Well, ultimately, these proteins are kind of like they become gooey and almost gummy and they stick. And then they start to have changes to your brain. So next thing you know, over the course of 20, 30 years, instead of your brain being like a nice soft sponge that's easy to push fluid through and drain, now your sponge starts to feel like one of those really hard sponges that you've used for 10 years and it sits down in your kitchen and your wife says, "Why are you using that sponge? It's old and it's gross." So that sponge that is really now and if you tried to even push fluid through it, no fluid would go through it because it's so dense and it's so clogged. That's a brain that's now has disease, but that whole process starts way upstream. So brain health, probably starts in your 20s and 30s. And I think things like don't smoke, don't drink too much alcohol. Alcohol is very hard on the liver. Alcohol is very hard on the brain. Um, trying to avoid developing diabetes, eating good holistic food, lots of fruits, lots of vegetables, probably less on the meat, more on the vegetables is probably more important. It's not what our culture says about what we should eat, but brain health would tell you that. And I just got done reading a book this weekend called Lymph and Longevity.
Yes.
It's written by a cardiovascular surgeon named Dr. Gerald Lamole. And I started reading it Friday night, couldn't put it down. 3/4 of the book, phenomenal. And the last third was kind of about recipes and supplements and stuff like that. But if you look at the recipes, it's interesting because it all matched up very, very closely with our friend that wrote the 30-Day Alzheimer's book, who were from Loma Linda, Dr. Is it Shiraz?
Dr. Sturshide.
Yeah, so
Dr. Dean Sturshide and
yeah, the doctors, the married couple, and boy, what an honor to meet them. But if you look at their book, which is beautiful, I'd recommend getting that book too. Their book principles match lymphatic health principles. And I don't think that's a coincidence. I think that the better you eat for your lymphatics, you're accomplishing the same thing of eating for your brain. The other big thing is hydration. Lots of clean water. And I get patients that come in that drink a lot of diet sodas. And I ask them to read the diet soda label and what percent of that diet soda is actually naturally part of your body. It's the water only. All the rest of it is artificial. So there's been some work out of Cleveland Clinic showing that some artificial sodas and diet sodas may contribute to heart disease. I think there's going to be more data coming out on that over the course of time, but I would suggest stick to clean water, stick to flavored waters, and try to stay away from a lot of the soda and the diet soda consumption. Again, a regular soda is no different than eating a Snicker bar. It's going to be, and I'm not saying anything bad about Snickers. We're not. I don't want the. Is Snickers sponsoring today's broadcast?
No, not even
No, okay.
broccoli.
Okay, so we're okay. We're okay on the conversation. So I just don't want to villainize anything, but if we could put up pictures of community gardens and things like that, that's just such that is so important. If you go back to the last time America was truly, truly healthy, the vast majority of America was healthy, it was right at the end of World War II. And I think this was in the book Omnivore's Dilemma by Hyman. I think what was going on, as I best recall from him describing it, is there had to be sugar rationing and meat rationing during World War II because it was too expensive and there wasn't enough production for it because the production was on the war effort. 40% of Americans had a victory garden. They were actually growing gardens in their own yards, and that's what they were eating a lot of their food from. And I don't think it's a coincidence that victory gardens during World War II and limiting some of this other stuff that we now know to be potentially harmful to our overall health over the course of time, it makes perfect sense. And just like you have led our community in gardening and community gardens, working with the Mayo medical students on these types of efforts, I think you're showing our next generation we need to get back to the concept of victory gardens like we experienced as a nation in the 1940s.
Great. I remember you and Doctors Dean and Aishai Thurside, you three were designing a research project right on spot in April.
Yeah, I tell you what, they're a power couple. They could get a lot of stuff done. I mean, that's why I'm so cautious to talk about brain health, because when you look at two physicians like them who are just brilliant in brain function, you want them to lead that conversation, and I'll lead the conversation on managing wounds.
Well, I think besides the wounds or the lymphatic, you also emphasize on the endothelial cell health.
Yes, those are the pavers that we talked about, like on a brick road. So you have 60,000 miles of blood vessels in your body. You have 3 trillion of those pavers lining all of those blood vessels. And those endothelial cell function is incredibly important.
I remember you mentioned about the endothelial cell health. That's why after you have a high salt meal, they will lead to your swelling, and how long you will take to remove it. You wanna explain that?
So when you look at salt, and let's just talk about sodium chloride, the most common salt is out there. A salt is always just a positive plus a negative, right? If you look at the electric vehicles that are driving around, their batteries are basically it's a salt. It's an anode and a cathode. So sodium chloride breaks apart after swallowing into sodium positive, chloride negative. What most people don't realize is your entire vascular system is negatively charged. So the inside lining, the endothelium, and then there's this complex sugar layer that's good sugars on top of the endothelium called the glycocalyx. So glyco sugar, calyx, just say complex. So that layer on top of the endothelium is negatively charged. So if you take a high salt diet, lots of sodium, positively charged, and you stick it to a negative charge, that prevents your endothelial cells from functioning. And so when you lose endothelial cell function in your lymphatics, they can't squeeze. So if you go to New York City and have a huge pastrami sandwich, and I remember that when this happened to me in 1998 when I was in New York City, I woke up the next morning from this phenomenal pastrami sandwich. My fingers looked like little sausages. They were so swollen.
Mm.
And it took my fingers about 2 days to get back to normal. Well, that was the salt load impacting my skin lymphatics. So they weren't working, so they couldn't drain the fluid. So now all that fluid's accumulating. Well,
Mm.
that probably did a little bit of something to, heart, lung, brain, all over the place. And I so agree. I just sitting here talking about pastrami on rye with Swiss. It's actually what I want because that sounds really good right now with some really good Dijon mustard. But that salt load, most Americans take in 3 to 4 grams of salt a day, and as you do that over the course of many years, you're just it's ongoing damage to your endothelial cells. So that's why we should be aiming for 2 grams of salt or less a day, because then we avoid that cumulative effect on our endothelial cells. Because once your endothelial cells get permanently damaged, they go from a nice, let's just say, feeling like a nice gummy bear. It's got structure, but it's very flexible, and it'll turn into like a feeling like a quarter. It becomes very stiff and they don't function anymore. And actually it's called calcification of your arteries.
Mm.
So your arteries are literally turning into almost like a bone-like structure. Well, now your arteries aren't functional. They can't dilate, they can't contract. For men, this is often seen later in life as erectile dysfunction.
Mm.
As you lose that blood vessel functionality and the ability to dilate, that's erectile dysfunction. That's why so many diabetics are dealing with that issue. So again, I think if the three of us had an opportunity where we would start this education, it's with the 25, 26-year-olds and the 30-year-olds and the 40-year-olds, because if we're going to have an impact on the tsunami of healthcare disorders that are going on in the United States, I mean, it almost seems like so many things now they're in epidemic levels or endemic levels. I think we got to start changing what's going on in our 20 and our 30-year-olds to impact health when you're 60, 70, 80.
Right.
Mm.
People don't see that far, and also because the stiff artery, and that's one of the reasons why people have hypertension, because they have to pump harder since the vessels are not flexible now.
Yes, you lose that
Mhm.
ability to open up or dilate the vessels.
Mhm.
Well, I think we talked a lot, and we probably scared a lot of people already.
Well, in
Well,
fact, I think this is very eye-opening, the way that how Dr. Melin is able to explain how the brain can, how sleep actually affect the brain function and the sponge. Now, I have the picture of the sponge got gum up and cannot have the fluid go through, and eventually I have to get rid of the sponge and get a new sponge. Okay, so our brain sponge.
Are you talking
Um,
about a brain transplant?
I'm thinking about how could the nutrition, plus the good sleep, can help us clean up this brain sponge, right? Isn't that a great picture for people to think about how important it is to be mindful about the time, not only the duration of the sleep, uh, but also what time go to sleep and what time get up. It really make a huge difference. And I remember after Dr. Molin's presentation in April, a lot of people talk about, okay, I have to pay attention on my position, sleep, and when should I go back to sleep, and the number of hours. This is amazing.
Yeah, and some of the data shows that sleeping flat is certainly better than sleeping on with your head elevated. Now, there are some people who really, really struggle to sleep with their head of their bed flat because they might have heart failure, kidney failure, liver failure. They might have low back pain.
Mhm.
Probably, and Jing, I'm sure you run into this too. Probably 20 to 30% of our patient population, they sleep in a chair.
Mm.
And so if your brain is always up here, it makes it harder. Now, and this seems counterintuitive. You would think if my brain is up here, I'll drain this fluid down quicker. It's actually, if you're sleeping with your head up, you drain the brain slower. Draining flat is the best way to get to pull the fluid out of the brain. It's actually similar to the legs. You'll hear people say that I go to bed with swollen legs. I wake up in the morning, my legs are not swollen anymore. It's the same concept at the opposite end. It's pulling the fluid out. Then when you get up, put your legs down, the swelling cycle starts all over again. And so that's why we talk about elevation, wearing compression socks, etc.
Mm.
And you made a statement that made me think about scaring people. None of this is meant to scare people. Education is
Mhm.
so important, and the job you both do for educating empowers people.
Mhm.
And if we're going to help with brain power, I think it's empowering. And I do think that people can make a difference. I don't think there's a point where you say all's lost. I think, and again, Dean and his wife,
Uh,
um, look at their look.
Dr. Yeah, Aisha. Yeah.
Yes, yes. Look at their cookbook. I
Mhm.
think that cookbook could be applied at any point in time. That's it. That book, I think that literally is one of the best books I have read this year. And I actually, so I'm going to tell you a secret. I bought 12 copies off Amazon after I met them because
Wow.
it's what I'm giving many of my family members for Christmas this year is that
Mhm.
book because I thought that
Wow.
book. I already gave it to my 92-year-old mother-in-law whose brain is phenomenal, but she has eaten like that book her entire life, and I
Wow.
think that's why at 92 she is so her brain is so good. And we just had a friend whose mom passed away over the weekend. Now, her cognitive status has been in decline for years. And I think there's probably some genetic components and stuff. So it's not to place blame, but I think we could all be better educated and we could all refocus our efforts. And maybe every 2 or 3 months we need to go back and look and say, what are we eating? Does it align with that book? And is it helping my brain? Because I think we all want to have good brains as we age. There's no sense in retiring and your brain doesn't work.
Mhm.
Right.
That's so true. Yep.
Yeah. And in terms of genetic, a lot of time people think that everything is genetic and there's not much they can do about it. So that's another thing we have to really educate them. Is the lifestyle. What would I to say is the gene pull the trigger. I'm sorry, the gene load the gun and our lifestyle pull the trigger. So that's the thing that we have.
Yeah. And there's a couple different thoughts on the genetics. There's the genetics we think of as the chromosomes, right? But
Mm,
there's also these
genetic.
genetics that impact blood vessel health.
Mm,
And for some people, if you've got a little bit of an abnormality in the specific to the genetics for the blood vessel health, taking B vitamins, taking vitamin C as a flavonoid, taking vitamin D3, taking diosmin hesperidin, which has been used in Europe for, gosh, 50 years, 10 randomized controlled studies, massive data on that. We just started selling diosmin hesperidin here because the data was so good. So there are some things, supplements, that in the correct dosing, taken as purified, well produced, and almost all those supplements are going to be a little bit more expensive. So buying a bunch of cheap supplements, I think all it does is it gives you expensive urine. And if I could, I would love to see that in the next 5 to 10 years, we draw blood specific at specific genetic differences, and we can personalize how to treat those patients. So if again, let's go back and talk about aerospace medicine, what NASA has done down in their biochemistry lab, where the leadership down there is Dr. Scott Smith and Dr. Sarah Zwart. And 12, 13 years ago, they actually led the effort that helped determine part of why astronaut eye health was changing in the International Space Station. And they looked that there are genetic differences in some of the astronauts, and they just published a really good report within the past year that one astronaut who had severe eye changes. Now, the eye is part of your brain, and it's a lot of dense small blood vessels, right? So it's kind of like an eye into the body. When your eye's not working, that tells you a lot about what's going on in the body. They got a specific type of B complex vitamin up to the space station, and this astronaut had the worst changes on OCT, measuring uh, retinal function. This by 2 weeks later, after taking this B complex, the changes had dramatically improved. And that was the only thing that changed for this astronaut. And obviously, astronauts eat incredibly well in the space station, right? I mean, they're followed very closely, calories, exercise, etc. But a B vitamin made a huge difference in how the retinal health was. You can't have an astronaut on orbit without functioning eyes.
Mm.
It's too difficult. And I go back to that case and how brilliant the work that Scott Smith and Sarah Zwart have done over the course of time to put together those biochemistry markers and then go back and trace it upstream to what the genetic differences were that are causing this. I would like to apply the exact same principles of, because that's small blood vessel health. That's how we heal our patients, is getting small blood vessels and lymphatics to work. And I think if we did a project like that here in the wound clinic, I think we'd be shocked at how many patients have a specific genetic component that's easily fixed with things like B complex, C, D, and diosmin hesperidin. In fact, we believe it so much that we put almost every one of our patients that we see at consult on these specific this specific vitamin regimen. So again, vitamins are vital to health. They're not just don't just take them mindlessly. You have to be, you got to take the right ones, and you want to do it right.
Yeah, so that's why
Vital to health.
we usually like to tell patients that test on gas and also treat them as medications. Don't just listen to someone, read somewhere, and buy it.
Yeah.
Yeah.
In Europe, a B vitamin is a prescription.
Mm.
And then if you think about folate, they started. So if you take a B complex, you're getting B6, B12, folate, riboflavin. So you can get B6 here very easily. But remember, they also put folate in our water system. They started that, or in our food system. I'm sorry. They started doing that in 1998. In Europe, there is no folate in the food system. So these differences are really important, and you could do population health studies to see how are we changing that. Of course, they put folate into the food system here to help with spinal cord deficits or spinal cord developmental disorders, and even look at iodine iodine has been in our food system since I think the early 1900s because of large goiters and also helping prevent birth defects. So that's been in our food system for a long, long time, and it's helped save countless lives and improve quality of life for so many of the people in the United States.
Mm,
And both of those are elemental components, much like a vitamin.
mm.
Wow. Well, it has been a very nice chat with you, but do you have any final recommendation, advice to the
Yeah,
listener?
I think what we need to do is we need to take Jeng and Mai and we need to replicate you guys times like 10,000. And we stick you as a couple in every major city across the United States. And because we really need people like you that are passionate about lifestyle medicine and about food. And if you looked at where we're standing today, 10,000 years ago, how did people eat, live, and sleep?
Mhm,
They would basically get up with the sun, go to bed with the
mhm,
sun. They
mhm,
caught a deer maybe once a month. They didn't have a refrigerator to store the meat, so you either eat it or it's done. And then you're harvesting a lot of fruits and berries and a very, very high fiber diet. And you're drinking all clean water because there wasn't a soda machine 10,000 years ago. So when people talk about paleo diet and some other specific diets, I'm a big Mediterranean style diet person, flavonoids, etc. Um, Truly, our ancestors were not catching a lot of meat. So balancing with a little bit of meat, clean fish, a lot of fiber through fruits and vegetables, I think is one, and getting good restorative nightly sleep
mhm,
is very important to overall health.
mhm.
And that is exactly what we heard from the indigenous people. Uh, our conversation with the former president of the Navajo Nation, and that is the way they have been doing. Yeah.
And especially need to recreate the relationship with the food, like how our ancestors taught us it way back then. So I think you are exactly right, Dr. Melin. To have a garden is such a sustainable way to get ourselves back to health. In order to work, in order to have a garden, you gotta put some effort, and it kind of catch your attention. You walk around, you move it, harvest, and share the food with your friend, neighbor. It's such a great way to connect with people as well.
Yes. So Dr. Merlin, if anyone has any questions, are they able to send you questions?
Probably best to send the questions to your site and you and I can go through it together is probably the easiest thing to do.
Hmm.
Sure. Absolutely.
Hmm. Yeah.
Absolutely. Thank you.
We also have a pleasure to have Dr. Melin return to our eighth annual Community Wellness Symposium in 2026 to give us a topic on this subject related to more toward the hypertension. So,
From
um,
the endothelial cells
mhm.
standpoint.
So we
Yeah,
are very excited.
I was so impressed with your meeting. It was terrific, very professional, well attended. I was humbled to speak right after Brian Carlson, who's here in plastic
Uh,
surgery, had given his talk and his life's journey, and Brian's message is incredibly powerful as well. So, yeah, it's a great honor to be able to come back and speak again next year. I appreciate the invite.
Well,
oh,
thank you.
thank you so much.
And uh, our keynote speaker next year will be the president of American Medical Association, Dr. Bobby McMullen. So you
So,
will share
yeah,
the
we are
stage.
very excited.
Amazing,
We're very
amazing that
excited.
you draw so. I mean, to draw on the president of AMA is a big deal.
To have you also is a big deal to
I
our
I'm
audience.
I'm your neighbor. I'm happy to support.
Well, that's the thing. People in Rochester, we just don't really realize how big, how famous Mayo Clinic is really is. When I was doing my fellowship, I saw the laboratory director, my fellowship director, day in, day out. I didn't see anything about him until one day we went to a conference in Switzerland. And I saw all those international orthopedic surgeons coming to coming to him and say, "Oh, Dr. Han." I was like, "Whoa, who is this guy?"
Yeah,
Yeah,
it's a privilege to shake Dr. Hahn's hand as well. What a gentleman.
yeah.
Yeah.
Uh,
So, we really appreciate your time, and I know you are very, very busy. So, thank you for sharing all this knowledge with us. Now, me as a non-clinical person, be able to digest it and use a very simple term to explain to people why sleep is so important. Sleep position is so important. There's so many things for me to share with people while we are on the road to do our health talk and cooking show. So this truly can benefit so many lives. We really thank you so much for your precious time. S- so Jen, should we close our podcast today?
Sure. Well, thanks for joining us on Healing Step to Wellness. I'm Dr. J.
And I'm May, guiding you toward the whole person health one
One step
and one bite at a
at a time.
time.
See
See
you
you
next
next
time.
time. Thank you so much.
Thank you.